Sponsored by Regeneron and Sanofi.
My name is Debbie. I love to travel. I love to spend time outdoors. I've been on DUPIXENT since 2017.
I'm Ore. I am a full-time college student double majoring in musical theater and psychology. I've been taking DUPIXENT since 2019.
I'm Anthony. I'm married. I have 3 wonderful daughters. Those rare moments when I can find the time, I'd love to get on my motorcycle and just go ride. And I started taking DUPIXENT in 2017. I've had severe eczema since the 3rd grade. When it was uncontrolled, I had rashes all over my body, and I was almost always itchy. It was just unbearable.
I went through treatment after treatment for my severe eczema. I even participated in 2 clinical trials. I was prescribed several different pills and creams. I walked around with a bag of medication, like this big, but nothing I tried seemed to be helping.
There are a lot of things I'll never forget about living with uncontrolled severe eczema. I get emotional just thinking about all those years that I had to deal with the itching and the scratching and wanting to hide all those rashes on my face. I can't ever imagine going back to that.
Consistently taking DUPIXENT has helped me stay ahead of my eczema. It took some time for me to feel confident in getting my routine down, but now I see injecting DUPIXENT as just another part of my life. I had to learn the process completely, how to order DUPIXENT, how to store it, how to inject myself, what day is best for me to do the injection, and how to remember to give myself the injection. I received injection training from my doctor. Then I leaned on the DUPIXENT My Way patient support program, which was a great resource for me when I was starting out. The key for me was setting a reminder on my phone, alerting me that it was my DUPIXENT day. Over time, it's gotten easier and easier for me to stay on track.
Before I started DUPIXENT, I talked to my doctor about all the medical conditions I had and medications I was taking.
Make sure you talk to your doctor about the potential benefits and risks of treatment, including the most common side effects, such as injection site reactions, and some serious side effects, such as allergic reactions, including skin reactions that can sometimes be severe, eye problems, psoriasis, and joint aches and pain.
For me, taking DUPIXENT has fit into my routine pretty well. To be honest, I wouldn't say I ever look forward to my injection. It's still something that I have to motivate myself to do, but it is something that helps my skin. It's not an everyday medication. I like the fact that I take it every 2 weeks like my doctor prescribed. I self-inject every other Saturday. Then after my injection, I get on with my day and I hang out with my friends.
When my Dupie day comes along, I have my routine down and feel comfortable with the process. After I'm done with the injection, it's like, okay, I'm done for the next 2 weeks. And I know I won't have to worry as much about my eczema. Everyone's experience with DUPIXENT is different, but for me, it has been effective in getting my severe eczema under control. I keep taking DUPIXENT because I remember what my skin was like before, and I like my skin now, and I want to keep that going.
What motivates me to take DUPIXENT is the relief that I experience. I know DUPIXENT works beneath the surface, treating my eczema from the inside. What I find remarkable is all the trials that have been done with DUPIXENT. It's been studied in adults, teens, and even children as young as 6 months old. They've collected safety data over 5 years in a study of adult patients. This helps me assess whether taking DUPIXENT long-term is the right choice for me.
For me, taking DUPIXENT means clearer skin and less itching as I go about my fun college life. I don't want to give that up.
I'm really proud of how far I've come with my treatment journey. I just want to keep moving forward with my eczema under control. That's why I'm working together with my doctor and staying on DUPIXENT.
I know my eczema is a chronic condition. DUPIXENT can help manage my chronic eczema as long as I take it just as my doctor prescribes. Taking DUPIXENT is an important part of my life. It has reduced the burden of eczema for me. Looking at it that way has helped me stay on DUPIXENT.
Important safety information. Do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT. Are pregnant or plan to become pregnant. It is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. Are breastfeeding or plan to breastfeed. It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, or if you have AD and asthma and use an asthma medicine. Do not change or stop your other medicines, including corticosteroid medicine or other asthma medicine, without talking to your healthcare provider. This may cause other symptoms that were controlled by those medicines to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions, including skin reactions, that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, skin rash, including rash that looks like a bullseye, or painful red or blue bumps under the skin, general ill feeling, itching, swollen lymph nodes, nausea or vomiting, joint pain, or cramps in your stomach area. Eye problems. Tell your healthcare provider right away if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. Your healthcare provider may send you to an ophthalmologist for an eye exam if needed. Psoriasis. This can happen in people with atopic dermatitis who receive DUPIXENT. Tell your healthcare provider about any new skin symptoms. Your healthcare provider may send you to a dermatologist for an examination if needed. Joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects in patients with eczema include injection site reactions, eye problems, including eye and eyelid inflammation, redness, swelling, itching, eye infection, dry eye, and blurred vision, cold sores in your mouth or on your lips, and high count of a certain white blood cell, eosinophilia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended DUPIXENT be administered by or under supervision of an adult. In children 6 months to less than 12 years of age, DUPIXENT should be given by a caregiver. Please see accompanying full prescribing information, including patient information.